Welcome to the Perinatal Palliative Care Coordinator Training. This is the result of collaborative work by myself, Dr. Denise Cote-Arsenault, a maternal child nurse with expertise in perinatal bereavement, Dr. Erin Denny-Kelsch, a palliative care physician, and Dr. Anthony Chow, Associate Professor of Library and Information Science and Instructional Technologies. It is our goal through this training to promote and standardize the role of the Perinatal Palliative Care Coordinator so that parents receive the best care possible at a highly vulnerable time in their life. Palliative care has been around for a while, but it's been misunderstood. It's an approach to medical care for patients with chronic or serious illness. The focus is on symptom management and comfort care. Perinatal palliative care is the most recent addition to palliative care and begins during pregnancy. Unlike hospice care, where the focus is on end of life, perinatal palliative care is focused on helping parents with decision-making about labor, delivery, and birth options for the baby. Perinatal care is complicated by the fact that the baby is still in utero. Care for the mother is from the obstetrician or maternal fetal medicine, but care for the baby is a different specialty area. After learning of their baby's diagnosis, parents likely need to meet with many specialists. It gets complicated and can be very confusing. Care in the perinatal period begins with the parents, then includes the newborn after birth. The care is supportive to the entire family with specific focuses on choices for the baby. In our research with parents continuing pregnancy with a life-limiting fetal diagnosis, we saw that parents' decision-making occurred in 3 phases. Phase 1 consists of identifying the specific decision that needs to be addressed. There are many decisions to be made, and when time permits, they can be discussed one at a time. Phase 2 is the most complex and causes the most angst and the most work. It can take a long time, sometimes over weeks or months, to work through that phase. There are many things to consider with each decision, and then a risk-benefit analysis is needed. There are objective factors that require information and understanding from the healthcare team. The fetal diagnosis, the prognosis, whether it's certain or uncertain, mother's health, and the impact of choices. Subjective factors are the parents' values, their spirituality, and culture. These may be different for each parent. The impact on the self, the couple, the baby, and on others must be considered. In phase 3, a decision is made and then communicated to others. Here are the most common reasons for consultation with the perinatal palliative care team. Anomalies are of varying severity, and families who need support and triggers for consultation. The perinatal palliative care involvement begins after fetal diagnosis and continues up to 3 months of the newborn's life. The focus of the training presented here is on the perinatal palliative care coordinator, a designated individual who works with each family. Through relationship building, the goals are to meet parent needs, reduce fragmentation of care through coordination, communicate with the parents and interdisciplinary team so that they are all on the same page, and lastly, to facilitate access to resources. Ultimately, the goal is for the parents to have no regrets when all is said and done. The perinatal palliative care coordinator should be a member of the primary perinatal palliative care team. The team is comprised of everyone who is caring for a family, and the composition needs to be individualized for each family. In addition to the obstetrical and maternal fetal medicine provider for the mother, neonatologists for the neonate, and a palliative care physician, there may be many specialists that might be available and involved because families need holistic and comprehensive care. Thus, beyond the expected nurses, social workers, and genetic counselors, there may be chaplains, child life specialists, and bereavement counselors.